Jessica's not feeling well today. She's had some heart issues, or I don't even want to call it that just yet.
We don't know yet.
And so we're going to the hospital, and we're doing this just to show everyone that hospitals outside the US and South America are not third world, disgusting.
They do have running water, look at that. And this is actually a day in history for us in Quito because we haven't been to the emergency room in this country yet, have we?
Right, ER free for 360 days, something like that. I don't even know.
I am almost protesting coming, but I've been sick for almost 4 weeks.
Today's a day where we actually get to explore ER world in Quito.
Here we go.
Here we go. Jessica in the US would go by herself to the hospital if needed, and I would go, if anything, for moral support, but I have to translate. So I get to...
I can do my own translating, he just wants to spend time with me.
You cannot do medical translation. Sí. Sí, para ella.
Es prohibido.
Ah, está bien. Okay. No more filming.
In a rural pain, how do you put at this moment the pain in your chest? 1 to 10.
Well, I can walk, so I guess it's not a 10. Like a 6, 7. It's not getting better either.
So how are you in this dust bowl of a hospital?
I really wish they had running water.
Our philosophy here in Ecuador has been, because healthcare here is so affordable, that we're trying to get everything out of the way. So we're getting colonoscopies, we're getting colonoscopies, we're getting, Jess, you're old, all right? We're in our 40s. We're getting colonoscopies done, or at least she is. I'm the picture of health. We're getting everything dental done possible. We're getting anything that has to be done at this point, because when we get to France, as much as it's not as expensive as the US, it still is a little bit pricier. We're not supposed to film in here, that's why I'm whispering. She cannot move or talk for the next minute. This is the quietest I've ever seen her in my life. That's right, I'm talking about you, Jess. You can't say a word. Can't say a word.
I never get time alone with you without the kids. Come here.
The hospitals are honeymoon suite.
I think this is the first time we've been alone in 8 months.
That's not funny. So the good news is that Jessica is doing okay. They think it's something muscular. So I think we can actually post this online, because this is not death impacting. And I still get to work while I'm hanging out here. So she gets to feel like she's getting taken care of. She's taking a nap right now. I get to work, and she's still gonna live. Oh.
What is you come over here to yawn on me with bad breath?
Yes, bad breath.
Yeah, bad. What's up?
You want to talk a little about healthcare? We thought we'd take a little bit of time at this point to talk about healthcare and how we take care of healthcare while we're not in the US. Everyone seems to have the misconception that healthcare outside the US or outside of any first world country is a crapshoot, it's a gamble. We've had nothing but amazing experiences so far.
Yeah, and we visited, well, so far we visited ERs, the ER room in 3 different countries, as well as had multiple doctor's appointments, OBG stuff. Tomorrow I'm having a colonoscopy. So far the healthcare has been amazing. I mean, equivalent to the US, and in some situations, even more modern technology. And our medical insurance that we have is traveler's medical insurance, so it only covers serious situations like broken bones, cancer, and evacuation insurance. So 100% of the time when we've had to visit a doctor, we've paid out of pocket.
What we've noticed is that since healthcare is much cheaper here, and it's cheaper, I guess, for a lot of reasons. I guess because insurance is cheaper, salaries are less, the pharmaceuticals don't charge as much here, and we found that it costs less to get more done. Here, they'll just do the test no matter what the case is. It's pretty cool.
Yeah, and for example, I don't know what today's going to cost. Will's already panicking, but we had an ER visit for Largo in Costa Rica where they did x-rays and a bunch of other stuff, and it was $350. And I'm not saying that's no money at all, but compared to if we were in the U.S. and had this, if I had to go to the hospital in the U.S. with our current insurance, this probably would not be covered, and it would be thousands. Right now I've had an echo, blood test, an x-ray, and now they're going to do, I have a cold compress, and they're going to do some injections to reduce the pain in my chest right here. Tomorrow I'm having a colonoscopy for $540, and I have no idea how much that costs in the U.S., but I'm going to guess they're in the thousands. So for people that don't have insurance that would be covered by, that's a lot of money.
Right, we recently got braces for Largo for $800.
Now they're just the top braces. They're not putting them on the bottom, I don't think.
No, I don't think so. But still, that's a couple grand in the U.S. Healthcare is good. You know,
Yeah, I have no complaints. None at all.
I mean, granted, we're going to the better hospitals in the city, so we're not hitting.
We're going to the private hospitals.
We're
not
going to
the
the private
public
hospitals. Even the public hospitals. We found when we were in the Galapagos public hospital, Largo had an ear infection. They went ahead and they gave him a shot. They gave him antibiotics, and it was free.
And he was in and out in 45 minutes.
Right. So don't knock it. It's just a matter of knowing what you need to get done and knowing where to go.
This is Jessica Suero reporting from Hospital Metropolitano in Quito from my hospital bed.
Cheers. All right, so we're done now. They poked you, they prodded you, they've done X-rays.
You want to see?
How much do you think it's going to cost, Jess?
I'm going to guess 700 because they did a lot. What are you going to guess?
I'm going to say $575.
Okay, let's see.
Price is right. We've all paid up, and the amount was $776. So Jessica won, and I think we had to pay because if we didn't, we'd have to deal with this guy right here behind me, who is part-time cashier and also part-time bouncer. I don't think I want to mess with him. Overall, very good experience with the hospital, with the emergency room, and
Yeah, very good.
note to user, don't take antibiotics unless you're prescribed antibiotics.
That's not what caused this.
No.
It was a virus.
We had
a really bad virus that caused the problems with the muscles.
Right, but Jessica had antibiotics laying around the house, and she thought that would be the solution to it. And the doctor said that almost could have killed her if she would have had issues with her valves. I don't know, I'm not a doctor, but I'll believe him over Dr. Mom.
You're funny. And if I felt better, I'd say something witty. But
And if you guys disagree with me out there, just let me know. Just got out of the hospital. I haven't had a bite to eat all day long, so I am heading to KFC reluctantly. It doesn't taste bad, but that just doesn't make me feel good afterwards.